So good morning. It's a fresh day and we've got two more points to go over this morning. Anxiety and children. So the 2 points I want to deal with, and they follow on from our talks yesterday where we were discussing the different types of anxiety. There was GAD, generalized anxiety disorder, there was social anxiety, and there was health anxiety, which is sometimes known as hypochondria. And you can catch up with those if you look down the list and check out the titles for those videos. They're in there somewhere. Please have a look by all means. Thank you so much for the support that I've been receiving. The comments have been very encouraging. Feel free to click the subscribe button if you'd like to keep up with the videos that I'm doing. So let's push on together. I would like to talk about anxiety disorders in children, and I'm using the National Health Service website. That's nhs.com, and I'm using it as a foundational building block because it's solid and accurate, and it's a base for us to start to understand more about these topics and then look at them individually and how they affect yourselves, your children, and obviously I've talked about my mental health disorders as well. So anxiety disorders in children. It's normal for children to feel worried or anxious from time to time, such as when they're starting school or nursery or moving to a new area. But for some children, anxiety affects their behaviour and thoughts every day, interfering with their school, home and social life. This is when you may need a professional to tackle it. So symptoms of anxiety in children. So if you've got a child, let's have a look and see if we can spot some of the symptoms that are signified and highlighted on this website for us to, just to help us to identify these problems. So signs to look out for in your child are finding it hard to concentrate, not sleeping or waking in the night with bad dreams, not eating properly, quickly getting angry or irritable and being out of control during outbursts. I know a few children like that. Constantly worrying or having negative thoughts, feeling tense or fidgety, or using the toilet too often, always crying, being clingy, complaining of tummy aches and feeling unwell. Separation anxiety is common in younger children, whereas older children and teenagers tend to worry more about school or have social anxiety, and we've talked about that in a previous video, you can see. How to help your anxious child. So let's look at the steps they put here to try to basically help you with your child. If your child is having problems with anxiety, there's plenty you can do to help. Above all, it's important to talk to your child about their anxiety or worries. Read more about how to help an anxious child, including self-help tips for parents of anxious children. Many children at different ages may have anxieties that will go away after a while with your reassurance. So you've got to put your own input in here and do what you can to obviously help. However, it's a good idea to seek professional help or reassurance yourself if your child is constantly anxious and it's not getting better or it's getting worse. Self-help is not working. It's affecting their school or family life or their friendships. So where can you go to get some help? Obviously, an appointment with a GP is a good place to start. You can talk to your GP on your own or with your child. Or your child might be able to have an appointment without you. If the GP thinks your child could have an anxiety disorder, they may refer them for an assessment at your local children's and young people's mental health services. If your child does not want to see a doctor, they may be able to get help directly from your local youth counselling service. For more information, visit this website, nhs.com, and in the search, type in anxiety disorders in children. There's links here and lots of very useful information. It's very clear and easy to understand. Treatments for anxiety disorders in children. The type of treatments offered will depend on your child's age and the cause of their anxiety. Counselling can help your child understand what's making them anxious and allow them to work through the situation. Cognitive behaviour therapy, CBT, which we've talked about, I've also done and I've also helped other people with. It's very powerful and it works. It does take some dedication and you tend to get out of something what you put in. So CBT is a talking therapy that can help your child manage their anxiety by changing the way they think and behave. There's links on these websites. You can go and learn more about these CBT methods and where you can get help for free locally. You can self-register your child on these courses, and you can obviously go along with them depending on their age and if you want to do that. Anxiety medicines may be offered to your child if their anxiety is severe or does not get better with talking therapies. They're usually only prescribed by doctors who specialise in children and young people's mental health. So, what is causing these anxieties in your child? Some children are simply born more anxious and less able to cope with stress than others. Children can also pick up anxious behaviour from being around anxious people. Some children develop anxiety after stressful events, such as frequently moving house or school. That's something that I definitely did every couple of years. Parents fighting or arguing, the death of a close relative or friend, becoming seriously ill or getting injured in an accident, school-related issues like exams and bullying, being abused or neglected. So clearly it's things that are pushing the limits of your child, their patience, their understanding, the pressure, the stress. All of these things are just bringing out the worst. They're kind of like what tends to happen, it seems, and for me, is things get bottled up and they find a way of getting out, and it's not always in the most helpful and productive way. Children with attention deficit hyperactive disorder, ADHD, and autistic spectrum disorders are more likely to have problems with anxiety. And again, those were things that I've been diagnosed with, I've struggled with. There's plenty of support on this website. It must be hard having a child and bringing him up in this world that we live in with all the extra stresses and worries of the internet and peer pressure, and you've got to have the latest tech, you've got to have this, you've got to have that. And then on top of that, they've got all these other issues that can sometimes be underlying. So it is a minefield to go through. And I would just suggest that you go on the NHS website and have a little look, have a little read through some of the different parts. And I'm just basically doing this because I've been asked a little bit more about how children and young adults are affected, because I was one of those once upon a time. So I hope that this short introduction has helped. And as I say, nhs.com, a very good website to go to. We will be looking at some CBT, doing some exercises. So thank you again for taking the time to watch my short video. Thank you very much.